Hi, I'm Dr. Hamilton Stubbs, board certified sleep specialist and certified nutrition specialist, and thank you for joining me on my YouTube channel. If you haven't already subscribed to this channel, hit the subscribe button and don't forget to hit notifications. I try to upload new videos on every Wednesday. And if you like the video, please give me a thumbs up and don't forget to share it. Today I want to talk to you about your mask. If you're on positive airway pressure therapy and you have problems with your CPAP mask, I hope that you won't do like my girlfriend's sister. I was talking to them the other day and I found out that her sister has a CPAP machine. We had all been together on like a virtual group talking about weight. Hey, COVID-19, gaining weight, it's real. So you have to do things to not gain extra weight if you're not able to exercise. So what her sister said is that she had a CPAP machine and that she wasn't using it. When I talked to her about why, it was because her mask didn't fit her comfortably. She said she just could never get used to it and she thought she slept better without her machine. Well, I know that if you go and talk to your doctor and you get adjusted maybe 2 times like her, there's a tendency to feel like I don't want to bother anyone, or maybe this isn't ever going to get right. And sometimes, you just don't feel like going back to the doctor for a 3rd or 4th time. But sometimes it is difficult to get the right fit. And if you get the right fit, you will sleep so much better. There are some people that CPAP is just not the best treatment option. So there are reasons to keep trying, and if you can't use CPAP, don't ignore your obstructive sleep apnea. Try to use alternative therapy. To ignore it is bad for your health and also bad for your wallet. So in our practice, we've had patients who just decided they weren't going to use their machine. And when we finally get them to come back in, it's usually because they have gotten a bill from the home health company or the home medical equipment company. And what is happening is, if you do not meet the requirements for your insurance company to pay for the rental of your equipment, the insurance company will not pay the home health company, and the home health company will pass the bill on to you. Now in our case, we weren't able to get that bill taken away because the insurance company would not go back and pay, even though the person was able to finally get on their equipment. But what we could do is get it so that they wouldn't have to make future out-of-pocket payments. The other reason is just your health. If you have obstructive sleep apnea syndrome and it is not treated properly or at all, you run the risk of having several serious medical problems. You can have a stroke or a heart attack. You can also have problems with just going into heart failure, irregular heartbeats, ending up in a cardiac lab thinking that you might need some treatment for a cardiac arrhythmia when it was really just you needed to use your CPAP machine. It can also affect your mood. I had one lady who didn't believe that she was having any problems with her mood. But she was in a grocery store, and this is prior to the pandemic, and somebody jumped in front of her as she was standing in line. She got so angry and got so violent that they called the police on her. So I had to write a letter and say that sometimes obstructive sleep apnea syndrome, untreated, will make people be more aggressive than they usually would be. We got her on treatment and she has more patience. So when you don't have a good night's sleep and it's going on for several nights, most people do get a little irritated. Now she may have been the extreme example because you don't know what else is going on in a person's life. But if you're having multiple stressors and you're not getting a good night's sleep, it will be more challenging. In my girlfriend's sister's case, she was trying to lose weight. And she was finding that she was hitting a plateau. She was doing everything that she thought she could do, but she wasn't losing any weight. And when she would go to the cafeteria at where she worked, she found herself picking out some things that she knew had too many calories for her to stay in the calorie limit that she had decided was where she needed to be to lose weight. So what I told her is that when you don't sleep well, it is difficult to stay on a diet because sleep is directly related to the hormones that control your appetite. The hormones control if you feel hungry, but also if you feel like you've had enough to eat. And these two hormones you may have heard of are called leptin and ghrelin. So the ghrelin level tends to go up, and the leptin level that says, hey, I've had enough to eat, that goes down. Then the other thing is, if you haven't had a good night's sleep, you start to feel tired and fatigued. The body translates this into, I need some energy. So when you walk past your buffet at the counter, at the lunch counter, you're probably not going to grab a salad or some low-calorie food item because your body is craving energy. And that translates into fats and sugars, carbohydrates. So you'll probably be more likely to get French fries or some fried food, maybe a burger, and you probably will have a little difficulty passing on the dessert. So at least that's what was happening to her. So this could make it difficult to lose weight. And just by getting her CPAP under her sleep apnea under control, she could get those hormones to be more in balance and make it easier for her to stay on that caloric limit that she had designated as what her body needed for a 24-hour period. The other thing is if you have problems with diabetes, it can make it difficult for you to stabilize your blood sugar. If you have problems with depression, sleep deprivation makes it difficult for your doctor to help control your depression. It can also make you feel depressed. It affects your memory. It makes it difficult for you to focus. And you just don't have the quality of life that you could be enjoying if you could open up your airway and get a good night's sleep. So if you're having problems with your mask, you don't want to just give up and put the machine away. We're going to talk about some things you can do to adjust that mask. But if you find that CPAP is not for you, then you may need to be evaluated for alternative treatments. And there are alternative treatments that include oral appliances, position therapy, different types of positive pressure machines, the Inspira, and then weight loss. So there's many things that we could be trying to see if you could sleep better. What you don't want to do is just take a sleeping pill, because if you're waking up and you have untreated sleep apnea, it's probably because your airway is closed. And if you sleep through that, you could drop your oxygen level into critically low levels and have severe complications of obstructive sleep apnea. So, the mask. The most common mask that people get put on from a sleep lab is a full face mask. And I'm going to try and show this to you. Now, I'm not recommending any particular type of mask, but this mask is going over the nose and the mouth, and it's a full face mask because of that. Sometimes this is very easy for a technician to put on at night when there's limited time, and it works for a lot of people, but not everyone. You can also see that the mask has some headgear, and it has a bar that sits on the forehead and cushions that go around the face, but pretty close to this person's eyes. So if you have a full face mask and you say, I just really don't like this mask, write down what it is you don't like about the mask, because a full face mask could be fitting you okay, but you may not like it because you want to watch television in bed and you can't put your glasses on. Or the mask is allowing air to blow up into your eyes, or you just think it doesn't fit right, so you keep adjusting the straps. You want to make sure that the mask is fitted properly, and sometimes this can't be done in a lab. You might need to be fitted at a home medical equipment company by a respiratory therapist, where they have more time and a bigger selection of masks, and they can measure your area, nose-mouth area, to see if you're a small, medium, or large mask. If you find that the mask is blowing air into your eyes, then you definitely want to do something about that, because you can get a chemical conjunctivitis due to that air. It will make your eyes red, it can dry out your eyes, and may actually cause some eye damage if you don't do something about it. So the treatment for that is not necessarily eye drops, it's adjusting the mask so that air doesn't blow into your eyes. Sometimes people just need to know how to put on a full face mask. If you're having problems with the mask fit and you always put the mask on before you get in bed, try putting the mask on after you are lying down in bed. What you want to do is stretch out in bed as if you're going to go to sleep, put your mask on, adjust the top straps first and then the bottoms. The bottom strap should be adjusted last. And sometimes this will give you a better fit on your face mask, on that full face mask. Sometimes people just can't tolerate a full face mask, and if that's your case, you might need something smaller. You can get a nasal mask, or you can get this, something like this. These are nasal pillows. Can you see that? And the nasal pillows are little inserts that go in the nostrils. Some people really like these, and other people just don't like having anything go into their nostril. You can get all different types of nasal masks that don't have inserts. Like this is the inserts. Some people love these, and you might be one of them. You can try this out. Now, some people just like to have a nasal mask, and the nasal mask can be different sizes. Some are very small and they fit just over your nostrils like a little cup. You can also get full face masks that don't cover the upper part of the body, upper part of the face, because they're covering down here and they have a little opening so that the nostrils sit on the top of this mask and gives you the same effect of covering the nose and the mouth for a full face mask. So you want to make sure that you got the right mask and the right fit. If your mask is, if you're adjusting your straps too much and your mask is too tight, you can have problems with headaches. You can also get pressure marks on your face, and if you're a person of color, these marks can become hyperpigmented, and I don't think you want to have a hyperpigmented or dark line on your face that outlines where your mask is sitting. So adjusting your mask too tight means that the mask doesn't fit correctly. If you have an old mask and you find that you're having to adjust the straps tighter and tighter, it's because you probably need either new headgear, a new mask, or the new cushions. So you don't want it to be too tight. Now you also don't want it to be too loose. When your mask is too loose, you could wake up with a dry mouth, and one way to know that your mask is not fitting correctly and it's too loose is if you have a machine that gives you some kind of indicator of your mask fit. When you wake up or when you look at the machine, you probably won't have a smiley face because the mask will have a big air leak. Sometimes people think the pressure is too high, and sometimes the pressure does feel very high. I remember once putting on a machine just so I can see what are my patients experiencing, and it was set at 10 centimeters of water pressure. And that is about the average pressure for most people on a positive airway pressure machine, CPAP machine. When that machine was on, it felt like I was going down the interstate with my head out the window, all of this air just blowing into my face. It was very uncomfortable. So that could be happening to you. If that is the case, you don't want to just simply turn down the pressure, have your doctor turn it down, or your health care provider turn it down without making sure that you're on a pressure that's adequate enough to open up your airway so you don't have hypopneas, apneas, and desaturations that could be dangerous. When you do turn it down, you could give yourself a false sense of security, thinking that I'm wearing my machine, so everything must be okay. No, it may not be okay if your treatment is suboptimal. Sometimes the pressure is turned down low to give you a chance to get adjusted to where you need to be. The other thing is using a ramp. The ramp is a little feature that allows the machine to be set at a lower pressure when you first turn it on, and then in time it will gradually increase up to the pressure that is prescribed to open up your airway. So it's ramping up, and it's called a ramp. The ramp can be set for different durations of time, and this is so that you have time to fall asleep. So I think most people set it somewhere between 10 to 15 minutes because they're asleep within that period of time. If you are waking up with a dry mouth, that could be because your mask doesn't fit correctly, the humidification on your machine is not right, or you could have a problem with your medications. So check your mask fit, the type of mask, the humidification. You might have your doctor adjust the pressures to see what happens. And if there's no problem found with your positive airway pressure machine or the mask, then if you're on medications, think about the side effects of your medications. And the best way to find out if you're on any medicine that's causing a dry mouth is to talk to the pharmacist who filled your prescription. A lot of pharmacies have a program where you can just ask the pharmacist to give you a printout or to look specifically for the side effect of dry mouth. Once you find out that it is one of your medicines, do not stop your medicine without talking to your healthcare provider. That medicine might need to be tapered, or maybe the doctor wants to do something so that you can tolerate your medicine without having a dry mouth. So you don't want to just make adjustments without talking to the prescribing physician. I hope this will help you if you have a positive airway pressure machine and you stopped using it because the mask wasn't comfortable. If you haven't already subscribed to my channel, hit that subscribe button and don't forget to turn on notifications. I try to make a new video on Wednesdays. If you have learned something here that's helpful, or if you know somebody that has a CPAP machine, especially if they stopped using it, please share this video. And I hope that you'll join me again. Thanks for signing on. It's been great to have you.